Johnson & Johnson plans to ask federal regulators to authorize a booster of its COVID vaccine this week. J&J's vaccine was popular among college students, athletes, and anyone else concerned about side effects and those who don't really love needles because it only required one shot. But if regulators approve a booster, those who got the J&J version could end up needing another dose anyway.
Studies have also shown it's less effective than Pfizer and Moderna's coronavirus vaccines, and the company hopes the booster will change that. Meghan Schiller's live with what local doctors are saying. Meghan?
I talked with an infectious disease specialist with Allegheny Health Network, and he says the news of this booster shot is good, but he doesn't think we're going to boost ourselves out of the pandemic anytime soon. Instead, he believes the focus should still be on getting the unvaccinated people vaccinated, and that includes our children. There's a common concern for some people who received the single-dose J&J vaccine.
I had always wondered if I would be, covered enough with the one shot or not.
I wasn't exactly sure how strong the one dose vaccine is. And I think any kind of booster is good for anything.
Both Maria Hartwick and Kelly Woodnicki tell me they're thankful that COVID didn't hit home, even if they feel a little less covered.
No, I have not. No. And I have a boy on the football team, going to school every day. So knock on wood.
So when news came out Monday about a potential for a J&J booster, they're interested, even if they're not yet qualified.
I think I would, to be protected. I don't want, to infect my parents, who are older, or anyone else.
I would not be eligible to get the booster right away. I work at Pitt, but I've been working from home. So I don't have any underlying conditions.
Allegheny Health Network's Dr. Nathan Shively says we have seen some wearing off or waning of vaccine effectiveness in Moderna and Pfizer, but it's wearing off to levels still higher than J&J's efficacy.
And so I think that's why those who have gotten the Johnson & Johnson vaccine have been looking forward to some potential news on boosters for them and whether that may bump the efficacy.
And now, even though J&J is potentially going to ask the FDA to consider this sometime this week, the talks about the booster shots aren't scheduled for mid to late October. So in the meantime, Dr. Shively says he wants unvaccinated people to find a shot, saying that the majority of hospitalizations and serious COVID cases right now in our area are still happening among unvaccinated people. Reporting live on the north side tonight, Meghan Schiller, KDKA News.
Thank you, Meghan.